Assalamu alaikum. Our today's lecture is about the metallic irritant with the name of antimony. Antimony it is used as emetics, as anti-protozoans, as anti-schistosomal, as veterinary uses. It is also used in the match head, जैसे मैंने पहले ही आपको बताया था जब हमने देखा था कि माचिस की डब्बी पे क्या लगा होता है और माचिस की तीली के ऊपर यानी मैच हेड पे क्या लगा होता है. दैट इज़ एंटीमनी क्लोरेट. इफ़ यू रिमेंबर दैट, इट इज़ आल्सो यूज्ड इन बुलेट्स, इन माइक्रो इलेक्ट्रॉनिक्स, in nuclear reactors, in ceramics, in enamels, in glass and in paint industries. So the uses of antimony are different, can be used as emetics in different जितने भी आपके anti-protozoan, anti-schistosomal uses हैं. You know that in veterinary uses also. Then it is used in the match head as antimony chlorate, and also used in the bullets, in the microelectronics, in the nuclear reactors, beside that in different industries like ceramics, enamels, glass and paint industries. So this is antimony in a solid form, so metallic irritant. This is again in a different form, antimony here. Some is raw, some is different. So in different forms it is available. Now the toxic dose is uncertain, don't know about that, and the death is due to cardiac toxicity, but if inhalation it leads to lung cancer. Then the diagnostic test is normal serum level is 0.05 into 0.50 deciliter. In diagnostic we use the blood CP, we do blood CP, LFT, amylase, lactate dehydrogenases. These are done to diagnose this. Then chest X-ray, there is ECG, there's pulmonary function test. So different preparations are done to diagnose this. What is the management of this? We do gastric lavage. Because of slow rate of absorption, gastric lavage is very much important. Then activated charcoal देते हैं and repeatedly देते हैं. With this it forms charcoal antimony complexes which is non-toxic, और इसी तरह इसको secretion से urinary excretion से निकाल देते हैं body से. Then we can do dialysis, then exchange transfusions can be done. Beside that hydration and electrolyte balance is seen. Hydration बहुत ज़्यादा ज़रूरी है. Because of electrolyte balance, dehydration जब होती है तो उसकी वजह से उसको ठीक करना ज़रूरी है. Antidotes which can be given is chelated agent देते हैं जैसे DMSA, dimercaptosuccinic acid or succimer, that can be used as a antidote. What are the sign and symptoms? Sign and symptoms are similar like arsenic poisoning. बिल्कुल उसी तरह के जो है ना वो डायरिया कस करता है जैसे कॉलरा लाइक राइस वाटर स्टूल की तरह. Inhalation is very dangerous, and in low doses it causes headache, dizziness and depressions, and in high doses it causes dermatitis, liver and kidney damage. Violent and frequent vomiting is done, leading towards death. The medical legal importance is that it is accidental and industrial, and it's not a suicidal or a homicidal. Postmortem appearance जो है उसकी like arsenic है. There is congestion of the organs, emaciation. So with this we finish this antimony.